So if the AQI is really bad, it's 200 and above, don't step out. Simple. Children have smaller lungs. They have to breathe faster. When you breathe faster, you take in more pollutants. If the particle size is smaller than 2.5, it can go right into the bloodstream. If you are getting exposed to such a high AQI, instead of immunity, you would become hyper-reactive. You become inflammatory. Too much of constant, recurrent exposure is changing your genetics.
Dr. Indu Khosla is a senior pediatric pulmonologist.
With over 30 years of experience treating children's lungs, she's now warning that lung damage is beginning earlier than ever before.
50% of asthmatics are diagnosed below the age of 6 years. As your child grows older, it is known to cause pneumonias, you get viral infections, neurocognitive, metabolic diseases, premature deaths.
Knowing this fact, what could a parent do to make sure that the child has the best lungs forever? One of the things everybody knows today in India is, the air pollution, the dust and PM 2.5, all these different particles. One of your presentations, you talk about 99% of India lives below WHO standards for air quality. So would love to understand what is happening to children's lungs with the different levels of particles that exist, from dust down to PM 2.5.
If we were to have it our way, all these things should not have been there because they are toxic for all of us, leave alone children. They are more for children, of course, but it is not required for any of us. So imagine you are on the line of control. If there's an attack on your country, what will the people do over here? They have to retaliate. They have to defend. So the lung has to defend. If lung lived in an atmosphere where there was no such thing, how will the lung live? Very nicely, healthily, happily. Now what is happening? There are so many attacks. So what is the lung? The lung has become an irritated organ. The lung has become a hyper-reactive organ.
And when you say so many attacks, just to understand, what have you seen as the increase of attacks?
So the increase of attack, the biggest attack is, according to me, our environment. Our environment, which has become like this because of all the vehicular emissions that we have, the construction activity. 6,000 sites in Mumbai, apart from the coastal road, the metro, is under construction. And I'm sure it is increasing every other day. I may have this figure which is a little outdated. So many sites, so much of dust. Then the weather change. Mumbai was blessed because we stayed next to the sea, 9 kilometers per hour. All our pollutant went to the sea. Now that has also become a problem because of the weather change. It has become 3 kilometers an hour. All right. So that is staying. Then if you have winter, the air becomes denser. When the air is denser, all these pollutants just stay down. They just don't climb up. And then it affects all of us, and more so our little children. So therefore, the lung is continuously under siege. So when it's continuously under siege, the nature of the lung is changing. The lung is now induced to fight.
Always fighting.
Always fighting.
The army can fight and
Always
rest,
fighting.
no rest.
Yes. It was a peace-loving organ, and now it has become a fighter organ. So it has become so-called, in common terms, an allergic organ or hyper-reactive organ. And therefore, we have more allergies, we have more asthma, okay? Much more than ever before. And you are asking me how these are different for children and for adults. So children have to have smaller lungs. They're still growing. Okay. They have to breathe faster. Their metabolic rates are higher because, again, they're growing. Because of that, also they breathe faster. Their lungs are airways, the tubes are smaller. So again, they have to breathe faster. When you breathe faster, you take in more pollutants. So that becomes a problem. Then they have outdoor activities in school. They are in playground. They're going down in the evening and playing. Adults who have got corporate jobs, you and me, are sitting inside offices. Children have to go out to play. It's necessary for them. Again, they get exposed to most of these things. And their lungs, the defense mechanisms are not as strong as adults, right? And they have to grow. If they don't grow, they will grow up with smaller volumes. So all these factors are causing a lot of problem in children's lungs today.
And to that point, when you were saying that, everybody talks about PM 2.5, this invisible thing. What is it exactly? What happens to a child when they're inhaling, in any city in India today, the level of PM 2.5, a child who is playing outside or, living in the outdoors, what is happening to their bodies with PM 2.5?
So when we breathe, certain particle sizes can go right inside the lung, and certain particles are stopped by our first layer of defense, that is our nose, the hair, the humidification. So if you have a particle size of 10 microns and above, it kind of stays in your upper airway, right? It doesn't go down because the first line of defense can take it. But if the particle size is smaller than 10 microns, it will go inside. It just wanders inside. It can go into the airways. Airways are big pathways for them, and it can just wander into that and just go into the airway right up to the level of alveoli. And if it's smaller than 2.5, it can go into the bloodstream also. Even 2.5 can manage, but even if it's smaller, it can go right into the bloodstream. So when these particles go down, they are again going to cause a lot of inflammation in the lungs. And when it enters the bloodstream, it is going to cause a lot of problem in the long run. It is known to cause metabolic diseases in adulthood as your child grows older. It is known to cause, in children, neurocognitive issues, development issues, right? So when the cognition, the intelligence of the child gets affected, when it goes down, it also predisposes the children to a lot of infections, right? So you can get more bronchitis or bronchiolitis, you must have heard of, those kind of infections. It can cause pneumonias in children. So all these problems will happen when you have these particulate matters going down. It brings down the defense of the lung, predisposing the child to recurrent infections. And when it causes denuded, the layer of the cells which are there because of inflammation gets damaged, and therefore bacteria and viruses enter the system, causing more pneumonias to these children.
The cells of the lungs.
Absolutely. So you get pneumonias, you get viral infections, you get recurrent upper respiratory infections, you get damage to the lung volume because if it happens again and again, the lung volume becomes lesser. As I mentioned, neurocognitive, metabolic diseases, premature deaths, all have been described with air pollution PM 2.5.
A lot of this damage, what I want to understand from you is that is there a permanent damage that is happening with PM 2.5?
It is going to be a permanent damage because the lung volume itself will become less. It is causing the lung to become allergic, which even if you do not have, so earlier we thought allergy and asthma runs in families, it is genetic, but chronic exposure to environment, a chronic exposure to any of these irritants, and I forgot to mention tobacco smoke, which is a huge problem by itself. All these things will damage the lungs to an extent, decrease the volume, change the nature of the lung, which I mentioned, and this will be a lifelong problem. It is not going to go away. So therefore, we do not see it as an immediate thing, but over a period of time, as it continues, it is going to become a problem. So I think people have to be aware of this. We tell parents that if your child is obese now, a little later, by the time the child is 20, 30, 40, child will develop diabetes or metabolic syndrome. They don't understand that because it is so far away. So the same is the problem here. So parents have to know, or people have to know that this is a problem which will affect them in the near future. So what we are talking about as pulmonologists, that we will see a generation of young COPDs. So when you have an adult, you have chronic obstructive pulmonary airway disease. It is described in the age group of 40s, 50s. If this continues, we will have children or young children or young adults at 20 and 30 getting a COPD. That is a worrisome thing.
And what happens with COPD?
To describe it very simply, it's like an asthma-like syndrome, chronic cough, chronic bronchitis, need for inhalers, decreasing productivity because you're constantly coughing. So your lungs, again, have got so damaged that you have a lot of obstructive airway disease. And then, so the lung and heart work in sync with each other. If your lungs get affected, slowly the pressure will come on the heart. So it's like all interlinked. So you will have young adults having chronic lung disease.
Does exposure to polluted air build immunity?
So immunity is fighting against germs. Immunity is not fighting against pollutants. So if I have a good immunity, I will not get infections from either viruses or bacteria. But when I'm exposed to environmental pollutants, I get hyper-reactive. I get allergies and asthma. That's got nothing to do with immunity. So what happens is, if a person has a viral infection, gets a cold and cough, a person has an allergy, gets a cold and cough. So it is not easy for a common person to differentiate that this is a viral infection causing cold and cough, or it is an environmental pollutant or an exposure to an allergen, an irritant, a trigger which has caused cold and cough. So that differentiation is important. Yes, if your child is getting fever, high fever, pneumonias, colds and cough, it's an immunity issue. But your child is constantly sniffling, wheezing, coughing, without any fever, without any evidence of infection, that is allergy and exposure to environment. So that differentiation should be there.
And, we're talking about permanent and not permanent. You see so many children in schools and they have this similar environmental situation, but every child reacts differently. How different is the damage between, a child who seems fine and a child whose nose got blocked by that trigger at that point, pollutant trigger?
So somewhere genetics has to play a role here.
Right.
But today what is happening is too much of constant recurrent exposure is changing your genetics. And that's called as epigenetics. It's when the environment changes and induces a change in your genetics. So a child who's staying well, or even on exposure to all these things, maybe little later on, maybe when he's a young adult, might start developing symptoms of allergy and asthma. So that can happen.
A lot of parents today are concerned about the AQI, and everybody looks online. What is the AQI today? The question is, what do you do with the AQI? Because like you said, the children have to play outside and, life has to go on. So what is your advice? Because parents must be coming to you all the time. What do you tell parents?
So I tell them to look at the AQI. So if the AQI is really bad, like it's 200 and above, it's bad for everyone, whether it's adult or a child, don't step out. Simple. Don't step out.
Above
AQI,
200, no stepping up.
no stepping out. Especially no outdoor physical activity. Because when you do a physical activity, you'll run, you'll jump, you'll pant, you'll take more air inside, and therefore you will take more pollutants. So definitely across all age groups, no stepping out. If you have an AQI of like a 150 to a 200, older kids maybe half an hour, 45 minutes. When I say older kids, I'm talking about teenagers, and even say kids between 5 to teenage group, maybe 150 to 200, maybe half an hour outside and then back in.
And if your child is 0 to 5?
Younger kids, no. Below 5, no. Growing lungs, protect them. So if you're a sensitive child, if you have a child with asthma, allergies, then 100 to 150 can also be a problem. So limit the amount of time that your child is outside. In Mumbai, we have to be satisfied if we have an AQI of 100.
100 is, these days, unfortunately,
Heaven.
great. Heaven.
Yeah.
Fresh air.
Yes. So 100 and 150, theek hai, go. Go out, have fun, is what I tell them. An older kid who's going to a school, AQI is bad, school bus, maybe wear a mask. The problem is the correct size of the mask. We don't have for small kids. Ideally, it should be an N95 mask. N95 mask is not easy to hold. We, as doctors, we know what we did in COVID, how difficult it was to breathe in that N95 mask. So, but that is what will protect your normal fancy looking, beautiful design cloth mask is not going to help you. So you need an N95 mask when you're going in a school bus, which has got open windows and things like that. So that's another thing. So outdoor activities where you're going to be exposed, like in a school bus, you need to take care.
As you talk to them about this air thing all the time, the parents, children, what do you feel is the biggest issue with parents?
So something which is not as an imminent danger, it takes time for people to realize. That's the first thing I would say. But parents of children who are getting recurrent coughs, wheezing, and are actually in and out of hospitals, they want answers from us why my child is getting this recurrent cough or recurrent wheezing. So when we explain to them, they do understand. But I feel somewhere down the line, they wonder what they can do. Can they change their house in this city? Probably no. Can they alter the construction activity around their house? Probably no. Can they prevent deforestation or weather change? Nothing. So that is a frustration I'm seeing in many people today.
A helplessness.
A helplessness, a frustration that they're seeing. And they are also frustrated seeing their children suffer. So it is a problem, and I can see a little change now in the understanding that it could be because of air pollution. They may be still ignorant of the long-term effects of air pollution, but they are beginning to understand that the coughs which don't go away or the recurrent infection their children are getting is probably because of air pollution. Yes, parents are asking for solutions for this. And I feel as doctors, it's our duty to educate them and try to say what best you can do given the situation or given what is there in our control to what we can do. And even about the diet, okay, how it can make them less allergic. If children are exposed to farm life, animals at a very young age, it changes their body type to a less allergic type. So we tell them that it's good idea, take a holiday, go to a place. I mean, you don't go to a city and stay in a 5-star and the same, rather than go out into a farm or a village like environment where the child is exposed to natural surrounding which actually boosts the child's immunity. So these are things that we keep telling parents that they can do when it comes to safeguarding their own children's health.
I really avoided asking you to subscribe till now, but my team has put a gun to my head, so please subscribe. For all of us to understand how seemingly random things in the environment can affect us so deeply, I would love you to talk about this case of the school child going with their bus through a quarry.
A 4-year-old child who came to us with recurrent cough. It was referred to me by a colleague of mine, and this child came from Gujarat. And the doctors there had tried to treat him, and this child was still falling sick. So he came to me, we modified the treatment, sent him back home. Again, the child came back, and the child was still the same. And that's the time we got like a little concerned why the child is not responding to the routine line of treatment. And we admitted him here and we did a few investigations. And in those investigations, we had to do a chest CT. It showed evidence of some kind of severe reaction, like an allergic reaction, which we call as hypersensitivity reaction, to something in the environment. So we went back to the drawing board. We had asked him about the routine causes of allergy, but he had said no, nothing. Incidentally, he lives in a remote town, like almost like a village, not really in the city. And then when we sat back with him, he said that the child goes to school, which is 20 kilometers from his house, and he goes in an open van. There is almost like a 10-kilometer stretch of a stone quarry where crushing of stone occurs, and the child goes through that quarry every single day. And then he tells me that when the child comes back home, he coughs much more than ever before. And when they were vacation, he doesn't cough so much at all. And that's how we realized it was the quarry and the kind of the dust particles which were coming out of the quarry, which was affecting the child's lungs. He changed the child's school, and the path of going, the child's cough is absolutely gone.
Wow.
So it was an eye opener even for us. So today, when we take history of patients who have cough, we have added one more element to our history taking is environment, which I even when I teach people, I tell them please take environmental history. It's very, very important.
And was it an open van or a school bus?
It was an open van,
Not a school
small
bus.
van with 4-5 children
Got
who
it.
were going into.
Parents smoking secondhand smoke. Do you find a lot of children affected by that as well?
Well, yes. Just like all the environmental pollutants that we've spoken about, tobacco is a proven trigger. So recently I had a mother who, whose baby was born small. The baby, babies are born, not only are their lungs small, the whole baby is born small. So this baby was born full term. A full term baby weighs anywhere from 2.5 to 3.5 kg. This baby was born just a 2 kg, was born full term, but just 2 kg. And then we were looking for causes why this baby is born small. And then I looked at the mom. I could make out that she is a smoker. And I spoke to her about it. So she says, Doc, I can't be without cigarettes. So I explained to her what harm it is already caused the baby. And if she continues to smoke, then it would be again a secondhand smoke to the baby. It would hamper the child's growth and the growth of the lungs, predispose the child to getting things like asthma. So she did understand it, but it's not easy to get rid of addictions.
And a lot of people have heard of secondhand smoke. But when we spoke last time, you spoke about third-hand smoke. Can you tell us what that is exactly?
So that is the smoke which lingers in the house of a smoker, right from a sofa set to a carpet or to any fabric, the clothes of the individual who's smoking. So you can get that the aroma, if I were to call the word aroma of the smoke, which will be it lingers on, and there are a variety of studies that say it may linger on from days to weeks to months. So that is a third hand smoke. Of course, the volume of exposure from a third hand smoke is much lesser than what you have from a second hand smoke or from direct smoking, but that itself also can cause a problem. So, many people will say, no, I don't smoke in the house, I smoke outside and come, but the clothes will still have, the breath will still have smoke, and it can last for hours at end. So you can still expose your child to smoke.
So, if you have a parent, one of the parents in the house, and they cannot stop smoking, like you said, it's addictive. What are the absolute non-negotiable rules that you would insist on to protect the child?
The first is stop smoking. Still stays the primary
The
rule.
first three are stop smoking.
Stop smoking. In fact, I could start and end there.
Right.
Okay. And then you would say, okay, smoke outside the house. When you come back, you need to, wash your face, wash your mouth, probably change your clothes, and then come in. So these are things that you may have to do if you're going to enter a house where you have a small child. Again, stop smoking is what I would say.
Apparently, I have to tell you that if you don't subscribe, YouTube assumes you have bad taste. So please subscribe. Are you happy now? We're talking about indoor air and how it can affect a child as well. In India, if everybody's worried about getting malaria and other things from mosquitoes, so everybody has a plug-in all out or a good night in their house. How does that affect the children's lungs?
These are slow poisons. We use lot of pesticides, chemicals. I think if we were to sit down and think from the morning that we get up to the night that we sleep, how many chemicals we expose ourselves to, it's like crazy. Yes, they are all slow poisons, and in a child who's sensitive, it can cause more problem than in a child who's not sensitive. But it's a chronic exposure somewhere is harmful for the lungs for sure. Be it a mosquito repellent that you may use, or be it people use scented candles. They use room fresheners,
Diffusers.
diffusers.
Yeah.
They can all cause problem. So you must try to keep your rooms. In fact, your house should be well ventilated. There should be sunlight coming inside. There should be no leakages, no fungi in the wall. This is what would be ideally recommended.
Like a lot of people have the all out on all the time in their house. So what is the long-term effect on a child, even though they may not see anything in the short term?
So the long-term effect could be right from kind of a chronic exposure to a toxin to something called as a hypersensitivity pneumonia. Hypersensitivity means your lungs become more sensitive to these kind of chemicals, and therefore you will get some changes of damage in your lungs. But that happens over a period of time. Some, of course, can be acute, but that is generally for certain other kind of stronger chemicals, I would say, and not to these kind of chemicals. But these are all chemicals, and they are best avoided.
What about agarbattis and dhoop and scented candles? Everybody uses scented candles to relax. How do they affect children?
So if you're using it once in a while, you use a scented candle, I don't think it's going to cause so much of a problem. But if it's it's a chronic everyday kind of a story, as a cumulative dose, it would become harmful. Agarbattis and dhoops, again, see, if you're using it in a place where the child is there. So suppose I don't want to touch religious sentiments of many people, but you really want to use it in another room where the child is not there. So, and you keep the windows open, so it will diffuse out. Maybe that should be okay. And it should not be like you're, fuming the whole house up with a lot of these kind of things. So that's definitely avoided. And if you have a child whom you know is again sensitive and who reacts to these things, then it's a definite no-no.
A lot of people talk about soft toys, cushions, carpets, and especially in children's rooms, soft toys and cushions. Children love surrounding their bed with 50 soft toys. Everybody uses a soft toy as a gift. What does that do to a child?
If your child has allergies like allergic rhinitis or allergic asthma, and the allergen is dust mite, So dust mite is not the dust particles that you see. Dust mite is actually a living organism which grows into your mattresses, your bed covers, your soft toys, your AC filters. It grows on humidity, heat, and these are mites which actually thrive on the lining of your when we sleep, our cells get shed off. So these dust mites live on the lining of our body cells, right? So when you have a child who's allergic and you have a lot of these soft toys on the bed, they can have severe allergies. Like they can have a rhinitis, they can have an eczema, they can have asthma. So these are the problems that children can have. In a child who's not allergic to these things, you may not get any problems. Okay, so you may have somebody who's lived all his life with a soft toy in the bed and not have problems. Having said that, it's a good idea to keep these things clean, vacuum them, wash them, so that you don't perpetuate the growth of dust mites in them.
As a pediatric pulmonologist, when you walk into a child's bedroom, what are the red flags that you see?
So when I get into a bedroom of a child, there are certain things which are an absolute no-no. So if you look at, in today's time and age, carpets, which can carry dust mites, soft toys in the bed, AC filters which may not be clean, walls which may have leakages and fungi growing on them, the black fungus which is typically can cause allergies and asthma, strong perfumes that are used, any scents of any kind, candles, maybe putting dhoops and agarbattis, and any kind of pesticides that are used in the room can be triggers for a child who's sensitive and a child who can be again made sensitive because of constant exposure to this. Parent who's smoking tobacco, which can be really bad for these children. I remember a case, a parent who came to me with a child who was constantly coughing. It was a 9-month-old child, and the child had started coughing from the age of 5 months, and multiple doctors he had changed before he came to us. And then he was with me for 2-3 weeks. I tried 2-3 different options, but his cough wouldn't go. And he was leaving my chamber, and he asked me, "Doc, which perfume do you use?" And I was like, why the hell is he getting personal like this? I just tried to, ward off that question and say, I don't remember, I told him. "No, doctor, you remember your perfume. Tell me which perfume you use." So I gave him a brand. I will make that and bring for you. I make all duplicate perfumes inside my house. So you tell me the brand and you will not make out whether this is the original or not. I said, sit down. First you stop that, then your child's cough will go. So this is what it can do to children.
Wow. I really don't think you have to keep telling them to subscribe. If they like it, they'll subscribe. So, I think it's fine. So let's talk a little bit about allergies and like asthma, like you said. And there's this quote, allergy was once the privilege of the sensitive, but is now the signature of our century. What has changed in the last years that you've been working in our children's immune systems?
So, what has happened is that the lungs were made by the Lord above to live in an environment which was friendly, nice, clean, in such a way that it would be tolerant and accepting to what is around it. But today, the way our climates have changed, the way our AQIs have changed, our environment has changed with so much pollutants, with so much of PM 2.5, the chemicals, the vehicular overload in our society, the amount of vehicular emissions, then also the construction activity, industries, all this is really polluting our environment. And that is impacting our lungs. So the lung is in a state of constant hyper-reactivity. The lung has to kind of combat all these things. It's as though it is on a line of control all the time where it is being attacked by all these pollutants. And therefore the lung has to combat this. It is bringing out some of its cells which fight this. And therefore the child is becoming more allergic than they were ever before. So this is what has changed. So we have more allergies, more asthma. It is across all strata of society. It is because we all breathe a common air. So air is not different from anybody in this country.
It's like the lungs were, like you said, receptive. It's like they were the. I was thinking of a good analogy. Like they were the saint or the nurse of the an open receptive organ, and now they've had to become the warrior. That is
Absolutely.
not their that was not their job basically.
Absolutely.
How does childhood asthma look different today from when you started in like the 2000s or
So, childhood asthma is evolving and changing in many ways, right from the incidence, the prevalence, the definition, and the guidelines of management. Lot of international studies called the ISAC study, which have been done in multiple phases, which has shown that the incidence is increasing in all countries. And it's not restricted to like LMICs, the lower middle income countries. It is across all countries. In fact, the mortality and morbidity of asthma and allergy is worse in the lower middle income countries because they don't take proper treatment and they don't reach out. Sometimes they don't reach out, as in they can't reach out to a medical facility, or they may not recognize their symptoms and go on time. So, and it is increasing even in the younger population. Like in adolescents, the incidence of allergic rhinitis is increasing. If even any room that you may sit, in any party that you may go to, or any, social gathering that you may be in, if you just generally ask, how many of you are allergic, you will be shocked to see that more than 60 to 70% of the room where hands will be up to say, okay, I'm allergic to this and I'm allergic to that. So the incidence and prevalence is going up. Guidelines, there is no cure for asthma. There is no cure, only the best at best. When we treat it, we can control it. So controllers are becoming better, and you can control the symptoms, but you will not get rid of the drugs. So you have to take drugs for life for controlling asthma and allergies. The other changes, like earlier we used to say, if there's a family history and genetics, if asthma in your family, then you're likely to be having asthma. The guidelines now say that even if don't have family history, but you have symptoms like recurrent cough, wheezing, breathlessness, etc., you still may be having asthma. And the diagnosis is beginning from children, young children as young as below 5. So these are things which have changed about asthma and allergy.
and today's environment, indoor, outdoor, everything. How are you seeing the rise of childhood asthma compared to before?
So the number of cases are increasing, severity is increasing, right? And younger kids are showing signs of inflammation. Though inflammation starts early, 50% of asthmatics are diagnosed below the age of 6 years. They're present at that age, right? So the environmental triggers are causing more and more asthma. Today, the new guidelines which have come in this year say you don't need a family history to diagnose asthma. So earlier, with all this, you needed a family history or genetics to support you. Now, even without a family history, our environment has become our family. That is also inducing asthma. So that is the change that we are seeing.
When a parent sees their child have a chronic cough or a repeated viral episode, when do you think that needs a specialist consultation rather than or just another antibiotic course?
So here there are two things. You may have asthma-like symptoms, like when you have chronic, dry, recurrent cough, means you're well and you will cough again. Cough is in the night and it's recurrent, and you may have other features of allergy. You may or may not have family history of asthma. This is asthma-like symptoms. The other end of the cough is when you have a wet cough. Okay. Now you have a child who has a productive cough. You will normally not see children bringing out sputum, or like an adult who may cough and hacking cough and bring. So if you have a wet cough, if your child is not gaining weight, or if you have other symptoms like diarrhea along with this, or any other infections, that's another spectrum of illness. It's not asthma, but it is chronic lung disease. That's also the time you need to go to the doctor. So these are two ends. And on the normal end is normal khasi sardi. You get a little fever, a little runny nose, a little cough. You may have a sick contact in the house. It lasts for 3 to 5 days and you're fine.
If a parent wants to reduce, because like you said, the environment, construction, all these things in cities has made it very tough. So if a parent wants to reduce how often a child falls sick without moving homes, moving cities, nobody can do that. what are the most effective changes they can make to their home, school, commute, their life?
I'll start from the very beginning. Okay. First of all, having normal deliveries.
Oh,
Increasing C-sections is increasing risks of allergy and asthma. There's enough evidence to show. Okay. When the mom is pregnant, she should eat good food. She should eat food which is rich in omega-3 fatty acids, that kind of good food. She should eat good food. She should not smoke. She should have good antenatal care, take her vitamins. Again, she'll produce a good baby.
100% evidence that C-sections cause.
Increased risk of allergy. So it may not be the only standalone risk, but it is a contributory risk. Okay, I'll tell you why. When a baby is born through a normal vaginal delivery, the baby gets exposed to a lot of flora, which lines the child's gut, prepares the gut for immune tolerance rather than allergies, right? So that is a very important step which disappears in a C-section. Then the next is breastfeeding. Okay, the more you breastfeed your child, you transmit your immunity to the baby. You're giving ready-made immunity. We plan so much for our children, unka education, unka insurance, unka money, unka business, God knows what not. This we can do very easily. We should breastfeed the babies, right? So breastfeeding. Then less use of antibiotics. Okay, sometimes doctors may write, but sometimes parents also insist, no, my child's annual day is there, we are traveling, please give antibiotics.
Really?
Yeah, of course.
Proactively.
Proactively, jaldi acha kar do. So less use of antibiotics, more use of good food in the form of fruits, vegetables, avoiding processed food, avoiding chemicals, right? And also I've seen that today, this is my thought. It may not be totally evidence based, but this is what I think, what I'm going to tell you now. So today, parents travel a lot with children. 1 month old, they travel. Pehle aisa bolte the 40 days don't step out of the house. For 6 months, let the baby's immune. So it's very important that in the first year of life, the child does not get recurrent infections. If you have recurrent infections, you will end up giving antibiotics. You're going to alter the child's flora. If you're going to travel here and there, you may stop even breastfeeding. You may use some other things. So if you in the formative years of the child's immune system, child is not even vaccinated fully. If we keep traveling, exposing the child to different atmospheres, nowadays they will say a 2 month old, can we put the baby in the swimming pool? Let the baby grow up. There's a full. So if you can avoid that also to expose the child less to stressful environments, you will reduce risk of infections and you will give babies better lungs. And then exposure to tobacco smoke and environmental pollutants, how much you can do, because there are so many things you can do to avoid it. So if you take care of all these things, you will definitely have healthier children.
And if you had to give children antibiotics, like you said, when they're young, and you have to give, I have some friends whose children ate something wrong when they were young. They got Shigella, all these things. So they had to take antibiotics 2-3 times. They were very anti-antibiotics. Okay, is there any way to rebuild the child's immunity system with probiotics or something? If they're 2, 3, 4 years old, and give them antibiotics.
Yes. So, see, antibiotics are life saving, but they should be given when required. So, if you're talking about Shigella is a gut infection which needs an antibiotic. You cannot treat Shigella without an antibiotic. But if you have viral respiratory infection like normal sardi khansi, be patient. It will be all right. It may take 7 days, 10 days. It's
Right.
okay. Don't give antibiotics there. So give antibiotics when required, if required. Okay, not otherwise. And of course, fruits, vegetables, probiotics, natural probiotics, yogurt. Our grandmother's dahi is one of the best things. Krishna Kanai also had dahi. So that's one of the best things to have. It's a good probiotic. It gets back your good bacteria in the gut and it simply helps you.
What are 3 questions that every parent should ask their pediatrician about their child?
Okay. So I think what is important is skills of parenting. Okay. Do's and don'ts. Foods, of course, what are healthy foods versus not healthy foods. What you parents should do to mentally stimulate the child to keep optimum brain growth. Let's put it like this. So it depends on genetics, it depends on diet, and third is the stimulation. Okay, so how parents should stimulate children. Parenting, I think today is a little bit of a forgotten art. Okay, we have single children in the family, single child, lot of problems. So good parenting skills, how to stimulate the child mentally, what is healthy food, and what about good sleep. I think these are four important things which I think pediatricians should educate parents, and parents should ask if the pediatrician has not educated them.
How can parents talk to children about pollution and the dangers of pollution in a way that makes them aware but doesn't frighten them?
Whenever a parent has to communicate with the child, it has to be in a fun way. One, very important, and then it has to be in a story format, because that's what children understand the best. And I think in an older child, probably you can talk upfront and honestly, and you can actually see, if you look out of your window, and if you look at the haze that you see, and you can't see a building today and you could see it yesterday, I think that you can actually, it is, the seeing is believing. So that way, in an older child, maybe you can explain that way. For in a younger child, maybe it may be difficult. I'm talking of children below the age of 6 years, may be difficult. But there you can tweak the outdoor activity into indoor activity without the child really
Make it
creating a
fun, make
fuss.
it playful.
Yeah, absolutely.
Is adolescent vaping a big thing?
It is. See, our government was so proactive to ban vaping before it hit the country. Unfortunately, it is not implemented. Today, anybody can get a vape sitting at home, right? What is vaping doing? It is damaging the lungs to another level. And children believe that vaping is not smoking and it is safer way of smoking. It is quite contradictory, because it has chemicals in it, and it is actually causing lung fibrosis like disease. It's causing damage to the lungs much worse than what tobacco can cause.
And how old are children who start vaping? When you see?
We have children from age 14 and 15 today who are vaping. And the number of it's like a status symbol to vape. So no, we are not doing tobacco smoking, we are doing vaping. For that matter, even hookah smoking has equivalent
Shisha bars.
Yeah, hookah and shisha are equally bad. They are going to cause damage to the lungs as any tobacco smoke would cause. So these are absolutely, I want to leave a message on this platform that vaping is going to leave you with bad lungs, with the effect on the lungs is irreversible. Unfortunately, it doesn't happen like I vape today and have a problem tomorrow. It's a slow growing problem, and there were a lot of studies which are done in the UK where the vaping first started, to see how you're getting something called as interstitial lung disease in children who vape. So it's a slow growing problem.
A lot of people think that vaping is better than cigarettes. Could you just shed some light on that?
Absolutely no. And that's a misconception, a myth which I would love to bust. Okay, so cigarette smoking has a lot of carcinogens, a lot of chemicals, more than 7,000 plus and 70 plus carcinogens. Okay, so it increases the risk of both chronic bronchitis, chronic obstructive lung disease as the children grow up, and risk of lung cancer. When we look at vaping, it has all the possible chemicals and more. It has got metals which go deeper into the lung, and what it does is it scars the lungs. Okay, you can have an acute lung injury, or you can have a chronic lung injury by scarring, and scarring is irreversible. Think of, if you get an injury and you get a scar, you cannot get rid of the scar. So it's something like this, that you're scarring your lungs. So, a word to the youngsters who are vaping, or even the adults who are vaping, that you're putting yourself in deeper problems if you're vaping. So both are bad, both are a no-no. And in no way is vaping milder. It may be worse than cigarette smoking.
How can we improve lung capacity naturally in children?
Exercising. Okay, if the children exercising, I don't mean going to the gym and lifting weights, but I mean just running, jumping, physical activity. So when you do a physical activity, you breathe deeper. When you breathe deeper, you're opening the small alveoli which are lying, tiny alveoli which are lying closed in maybe the upper lobes of the lung and the lower lobes of the lung. So exercising and of course preventing injury. When you prevent injury to the lungs, you do not reduce your lung capacities. So that will happen if you don't fall sick, in a sense, whatever way you can prevent it.
How do parents avoid injuries to their children's lungs?
So you prevent injuries to the lung by eating the correct food. Okay, mothers first breastfeeding the babies, eating the correct food in the form of fruits, vegetables, probiotics, avoiding overcrowded places. To some extent, I would say children going very early to schools are at a higher risk of getting viral infections like the RSV infection, the rhinovirus, etc. Now, every infection damages your lung, right? So prevention of infection. So avoid going to overcrowded places. I think children should not go to school very early because it increases the risk of recurrent infections. So if you avoid infections, and of course take your vaccinations, certain infections can be prevented by taking vaccinations. So vaccinations, good food, avoiding infections, avoiding overcrowded places, avoiding toxins like tobacco smoke will give you a better lung.